If you were to design a strategy to make America healthy again, what would that look like?
Part its nest, right? Health looks like nutrition in the home, healthy people mentally. It looks like thriving families and thriving communities. And that's the work we're about at Nest. We're very much aligned that nutrition is important to health and that we have been, in some ways that the poor foods we've been feeding our children, especially low income children, are kind of the next tobacco issue is we're poisoning our kids, right? We're feeding them dyes and sugars that are making them sick. And so, yeah, I align with that. We should be thinking about healthy foods. We should be thinking about mental well being. We have had a sick care system for a very long time, and we are one of the unhealthiest countries in the developed world. So, I do think a fresh approach to this is helpful. But what I hope will not happen, and it certainly is, we know vaccines have saved more lives than any single intervention in human history. So let's not tamper with that. We just had some measles cases in Texas. That's extremely concerning. We know that healthcare, in my view, is a human right. Let's not take healthcare away from people and have them suffering needlessly of ailments that are preventable in a country that is wealthy and can afford it. That's unacceptable from a human rights standpoint. And it also will not save us money because we've tried that and it has not worked. So I think where I align with this administration is, primary care is a priority. Let's prevent illness. Let's stop focusing on things that don't work. Let's look at creative approaches for partnership. So I do hope that these approaches can make more prioritization possible for Nest. Because one thing I'll say that's frustrating as a CEO of a company focused on children and mothers is we've really neglected them, right? We
Mm,
don't invest in our children to the level we should. We spend so much on end of life and seniors, and we don't invest in children's nutrition in the way we should, and in their education and the prevention of illness. And that is so important. So I'd love to see, and also when we're so focused on savings in 1 year. If I'm dealing with a baby that gets no care, I'm not going to save money if I care for that baby in that year. I will save money over years. So I'm also interested in what are those approaches to look at longer term gains for society, which are more, focused on the health function rather than the sick function.